Assalamu alaikum and good day. We are going to look into environmental pathology. In this lecture, we're going to look into certain substances in the environment that can have damaging effect on organ systems. We're going to define environmental pathology. We're going to list the common environmental exposure and list the effects of smoking and alcohol, describe the negative effects of commonly abused drugs, and describe negative effects of common therapeutic drugs. And lastly, we're going to describe the effects of radiation. The term environmental pathology refers to conditions caused by exposure to chemical or physical agents in the ambient, workplace, and personal environment, including diseases of nutritional origin. The exposure can be voluntary, like in drug abuse, alcohol abuse, and cigarette smoking, or the exposure can be involuntary, like exposures of drug, ethanol, and tobacco to infants and fetuses. The International Labour Organization estimates that the work-related injuries and illnesses kill approximately 2.3 million people per year. Climate change stands to become the most important global cause of environmental disease in the 21st century and beyond. The greenhouse effect caused by increases in pollutants of carbon dioxide, methane, and ozone have contributed to record-breaking global temperatures. The 5 years from 2014 to 2018 have been the warmest since 1880. During 2018, the global land temperature was 1.1 degrees Celsius warmer than the 20th century average. Cardiovascular, cerebrovascular, and respiratory diseases will be exacerbated by heat waves and air pollution. Gastroenteritis and infectious disease epidemics caused by water and food contamination as a consequence of floods and disruption of clean water supplies and sewage treatment can occur. Vector-borne infectious diseases such as dengue fever, malaria, as a consequence of changes in vector number and geographic distribution caused by increased temperature, crop failures, and more frequent El Niño climate cycles. And lastly, malnutrition caused by disruption of crops, mostly in tropical locations in which average temperatures are near or above crop tolerance levels. Pollutants in the air, water, and soil are absorbed through the lungs, the GI tract, and skin. In the body, they may act at the site of absorption, but are generally transported through the bloodstream to various organs where they may be stored or metabolized. Xenobiotics, or exogenous chemicals in the environment, may be metabolized to water-soluble compounds that are excreted or to toxic metabolites, a process referred to as activation. Xenobiotics can be metabolized to non-toxic metabolites through various types of reactions, and they are eliminated from the body through urine, bile, or feces. Xenobiotic metabolism may also result in the formation of a reactive metabolite that is toxic to the cellular components. Damaged cells and organs can undergo molecular and cellular repair, but if repair is not effective, short-term and long-term effects develop. In this lecture, we will cover common environmental exposures from air pollution, metal pollutants, tobacco, alcohol, drug abuse, therapeutic drugs, and radiation. Nutrition will be covered in another lecture. First, we look at air pollution comprising of ozone, sulfur dioxide, particulates, and carbon monoxide. We have two types of ozone, the high-level ozone, which helps to absorb harmful UV radiation, and also the ground ozone, which is released by industrial emissions and motor vehicle exhaust. Ground ozone is toxic and it's mediated by the production of free radicals which injure respiratory epithelial cells and alveolar cells, and this causes release of inflammatory mediators. This causes upper respiratory tract inflammation, decreased lung function, chest discomfort, and its exposure is more dangerous for people with asthma and emphysema. Next, we look at carbon monoxide, which is a gas that is produced by incomplete oxidation of carbonaceous materials. The sources of carbon monoxide include automotive engines like car engines, industrial processes using fossil fuels, wood and charcoal burning, and cigarette smoke. Carbon monoxide is a systemic asphyxiant that kills by inducing CNS depression. Our red blood cells, hemoglobin, has 200-fold greater affinity for carbon monoxide than for oxygen, and the resultant carboxyhemoglobin does not carry oxygen. So systemic hypoxia can develop when the hemoglobin is 20 to 30% saturated with carbon monoxide, and that can lead to collapse, unconsciousness, and death with 60% to 70% saturation. Another pollutant is sulfur dioxide, which is produced by power plants burning coal and oil from copper smelting and paper mills. Sulfur dioxide can be converted into sulfuric acid and sulfuric trioxide, which can cause a burning sensation in the nose and throat, difficulty in breathing, and asthma attacks in susceptible individuals. We all have seen the haze that happens almost every year in Malaysia. So this is caused by particulate matter, which are emitted by coal and oil-fired power plants, by industrial processes burning oil and coal, and by diesel exhaust. It can be inhaled into the alveoli where they are phagocytosed by macrophages and neutrophils, which release inflammatory mediators. They can also cause irritation into the eyes, the throat, the lungs, induce asthma attacks, and also promote myocardial ischemia. Now we look at the metals that can be environmental pollutants, such as lead, mercury, arsenic, and cadmium. Lead can be found in spray painting, foundry work, mining, battery burning. It can also be found in water supply, paint dust and flakes, automotive exhaust, and urban soil. Most of the absorbed lead is incorporated into bone and teeth, where it competes with calcium. Lead interferes with calcium-dependent control of neurotransmitter function, so it can lead to disturbances in the CNS in children and adults. Peripheral neuropathies predominate in adults, but children absorb more than 50% of ingested lead because of a higher permeability of the blood-brain barrier. Lead interferes with the normal remodeling of cartilage, which inhibits the healing of fractures, and also can cause anemia by suppression of hemoglobin synthesis. Mercury binds to certain proteins with high affinity that can lead to damage in the CNS and the kidney. The sources of mercury are in contaminated fish and mercury vapors released from dental amalgams. The developing brain is extremely sensitive to methyl mercury. It can accumulate in the brain, disturbs neuromotor, cognitive, and behavioral functions. To protect against potential fetal brain damage, the Center for Disease Control has recommended that pregnant women avoid consumption of fish known to contain high levels of mercury, like swordfish, shark, and king mackerel. Arsenic interfere with several aspects of cellular metabolism and can lead to toxicities in GIT, nervous system, the skin, and the heart. Arsenic is found naturally in soils and water and used as wood preservers, herbicides, Chinese and Indian herbal medicine. It can cause severe GIT, CVS, and CNS disturbances that are often fatal. It can interfere with mitochondrial oxidative phosphorylation and can cause hypoxia. It can increase risk for development of cancers in almost all tissues, especially the lung, the bladder, and the skin. Cadmium is especially toxic to the kidneys and to the lungs, and it is caused by increased production of reactive oxygen species. Um, the reactive oxygen species can increase lipid peroxidation and depletion of glutathione. In the lungs, it can cause necrosis of the alveolar macrophages, which leads to obstructive lung disease. And it can also cause tubular damage that can progress to end-stage renal failure in the kidney. It can also cause skeletal abnormalities associated with calcium loss.